Almost. Okay.
Yes.
And now you are having this eye problem only most.
Yes. Basically, this is the major problem now.
And do you have any fatigue after this corona and this COVID?
Get you, doctor.
Do you have any tiredness? You are feeling tired now?
I'm not to get you, doctor. I can't hear you properly.
Hello? Now can you hear me? Now can you hear me?
I feel tiredness, doctor.
And what about your food?
Food habit has changed a lot, doctor. My diet is very, very small now.
You are not getting appetite.
Yes.
So now you are in where you are actually? Your native place?
So my native is in Nainital North. Yeah.
You are working there also?
No, I'm working in Ghaziabad.
Delhi, you can say.
Delhi, I can say.
So can you come over here?
Yes, we
yes.
can plan because we have to plan for travel. But I would like to understand that what kind of treatment or how we are going to do, and
see,
whether it can be cured there.
What happened is in your brain some ischemic changes are there.
Okay.
Due to that bleeding. So that may lead to the optic nerve, I think. Sometimes that is the cause of this eye vision problem. Hello.
Sir, yeah, we are trying to understand. So you must.
So for that, there is no other treatment is not effective. You have to come over here and we can you with the inspection of the doctors. You should admit here.
Okay.
Then we shall do some treatment for that for brain.
Yeah. So, sir, you must have seen that the problem is in the brain.
Yes, that optic that will affect other nerves also. The cranial nerves also there. The optic nerve, one of the cranial nerve is optic nerve. So, is there any impairment of the optical nerve or optic nerve?
That is not there because we have visited many doctors and we also did one test in AIMS that was done last month. So they conducted actually a CT scan of the blood vessels which goes to the brain, and there also they could not find any problem. So
what happened is at that time while she was in the ICU, some infection was happened, and some ischemic changes also happened due to hemorrhage. So due to some ischemic change, that bleeding, hemorrhage also happened in some parts of the brain. That is still persisting. That in the MRI, we can see some changes were there, ischemic changes in the brain.
So in the brain actually
some of the cells involved in that ischemic changes. So that may be due to that hemorrhage. Correct. That may be the leading factor of this eye problem. That is assumption only. We can't. We are not. MRI. I think there is no that type of description. But anyway, some cells of the brain is lost.
Correct.
That may be the reason.
Yeah,
the optic nerve is okay. Optic nerve is working. Other side is she is okay. Is it not?
Yeah, her eyes are perfect because when we go for eye test, so she can read also on the screen till the last line. Her vision is 6/6, but that is
8/6. It is improved. It is improved.
Correct.
Okay.
So only in that narrow escape, narrow range.
Due to necrosis. Yes. So for that only we are doing some treatment for that. So for that you have to come over here, and we shall discuss with the physician and ophthalmologist.
Right. So we are actually trying to understand because
how the treatment will go.
Problem with brain.
Yeah, brain. Due to that, COVID is first reason, and due to the COVID, she has to stay in the ICU about 14 days or like that.
Yes, 14.
At that time, NIC was occurred. That may be the reason due to this degeneration or some lesion lost in the brain. That is mentioned in the MRI.
Yeah.
Some ischemic changes is there in the brain cells.
In the brain,
that may be
correct. In the brain, there is they call it infarct. So basically, these neurons have been damaged in the occipital region.
Yeah.
So what we have discussed with all the doctors, so they say now there is the neuroplasticity of the brain that works. So the other neurons of the other peripheral region, so they can connect, and then that way the vision will improve. So what we are looking for here is whether there is a treatment for improving the
that is what is we have to go through one OCT of the eye, that is scanning, that we shall do, and we have to find out what is the reason. That is what I am telling you have to come over here.
Okay. So you said OCT we have to do. What is the OCT, sir?
OCT done. The doctor will tell what is the.
Okay. Yeah, because what I am actually trying to understand, if we can get more idea about the treatment we have.
OCT.
Yeah.
Hello, OCT is the scanning only, the ophthalmic CT scan.
Yeah, so actually in eyes we have done that peripheral vision test also. There is no problem in eye and not also in optic nerve. So the problem is in the brain.
Okay, of course.
That is clear because we have actually visited n number of doctors here in Delhi NCR, and the treatment also is going in Fortis. So we have consulted their ophthalmologist is also there. She has been regularly seeing the patient. So on eye side there is nothing. On optic nerve it is not. It is a very clear case of the brain problem, and we are trying to understand because you are a specialist in eye care on the Ayurvedic side. So whether there is anything you have done previously where the patient problem is actually in brain. So here the problem is in brain.
Yes. You see, there are so many MS, that is multiple sclerosis. So many patients are coming with multiple sclerosis. So in that, one of the reason is optic nerve impacts. So this type of disease, first we have to diagnose what is the cause. So without coming, we can't diagnose what is the problem actually. Because I have seen this report and the doctors MRI scanning and some report only.
Yes.
So if you come over here, we will do the complete ophthalmic test.
Okay.
And if it is okay, then we shall think it of brain only. So for if it is brain, the neuro doctors are here and we can do the Ayurvedic treatment for that.
And how much time it will take for diagnosis and approximate?
Diagnosis, but 7 days is 1 week is sufficient.
1 week is required for diagnosis and for treatment.
Diagnosis and some treatment, trial treatment.
No, this 7 days you are saying including treatment or only for diagnosis?
First ophthalmologist will see the patient. And if it is not due to the optic nerve or not related to the eye, then we shall do some treatment for the brain only.
Okay.
That is what I am telling.
Yeah.
If he is having without any ophthalmic problem, then we will treat for brain only.
Yeah.
So due to this problem, in ophthalmic nerve and other things, optic nerve is almost functioning. In the it has been told. But the patient is not having the sight, normal sight is not there.
तो पूछ रहा था कि डॉक्टर साहब उसमें जो ट्रीटमेंट का टाइम है 1 week या 1 week?
1 week is for diagnostic aspects.
Yeah.
Treatment up to that. We will see the problem, then only we shall decide how many days treatment is needed like that.
But treatment will take maybe approx say what 1 week, 2 week, 3 week, and whether it is
Yes, but minimum 21 days you expect, except some
21 days, and it has to be means one has to be admitted there.
Yeah, you take admission for that.
Yeah, so total about a month is required.
Yeah, yes.
Right. And can you discuss this case with your ophthalmologist? I can send few more reports.
See, I am not an ophthalmologist. I am the neuro physician only.
Yeah.
So by that time, we shall see ophthalmologist doctors, or if you take some consultation with ophthalmic doctors here.
Correct. No, we can take that consultation if we can do some discussion more online. No, so coming. My idea is for the treatment we need to come. That is fine because we will have to come.
Yes,
that's online.
That's correct. That's good.
But if we can have some diagnosis online, so that we also get a clarity, the doctor also get a clarity, that will be helpful.
Just a minute. Sorry for the interruption, sir. What doctor wanted to convey you is once you come here directly with the patient, diagnosis and treatment can happen simultaneously. Okay.
Yeah.
Because ophthalmologic diagnosis even online is not actually recommended always for this condition. So you please come here. You bring the patient also. We will do all these scans. Dr. Subramaniam will be there. Our ophthalmologist will also be there. Both of them will discuss and then only they will start the treatment. I hope that is what Dr. Subramaniam wanted to convey to you.
Yes.
Isn't it, doctor?
Yes.
Please go ahead.
And any timelines you have, means any dates, availability of the doctors, or we have to book that in advance? What is the procedure for that?
Yes, sir. Booking details and all we can send you. Every day our senior doctors are available. Okay. Even Saturdays and Sundays also we do the treatments. Doctors will be available. Okay. Based on your schedule, you can plan to come.
Madam, you have doctors for ophthalmologist, and you have some neuro expert also there?
Yes, sir. Dr. Subramaniam is a neurologist, and we have lot of ophthalmologists here.
Right. So can I share more detail with you about the case, because I have few more reports that will give you more clarity?
You can share, sir. Not an issue. But right now, when you bring the patient, you can bring all the reports also. Okay. That will be more apt.
Okay. We will discuss this because we will also try to understand. And I will come back to you.
Okay.
Monica, anything else?
No, nothing. It's okay.
Subramanian doctor, prescription undo?
Prescription
Okay. Sir, now doctor will not send the prescription because you are actually recommended for an inpatient treatment as early as possible. So you can discuss with the family members and can just drop a message in WhatsApp. Our team will reply you, sir. Okay.
Okay.
Okay, sir. Thank you. Thank you, doctor.
Thank you,
Thank you. Thank you.